I'm going to show you the exact rehab program and exercises that I give my patients to help fix posterior tibial tendonitis pain. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine physician currently practicing in the San Francisco Bay Area, and I've helped hundreds of people overcome stubborn ankle issues like posterior tibial tendonitis as well as posterior tibial tendon dysfunction. In this video, I'll guide you through a focused rehab program designed to relieve pain, restore ankle stability, and get you back doing the activities that you love. The first thing we need to do is a quick warm-up, and we'll start by working on ankle range of motion. Begin by moving your ankle in a large controlled clockwise circle. Do this 10 times, focusing on smooth, full rotations. Then switch directions and go counterclockwise for another 10 reps. This movement helps increase circulation and gently mobilize the soft tissues around the ankle joint. Gentle, controlled motion helps reduce stiffness, decrease tension in the tendons, and prepare the ankle for more active work. Once the ankle is warmed up and moving more freely, it's time to start building stability and control, and that begins with balance. We'll first start off with a single leg balance for 30 seconds. To do this, stand tall near a wall or sturdy surface in case you need support. Shift your weight onto one leg and slowly lift the other foot off the ground, keeping your hips level and your core engaged. Try not to let your standing knee lock out completely. Keep a soft bend. Once you're steady, challenge your proprioception by closing your eyes if it's safe to do so. This significantly increases the difficulty and enhances your body's ability to stabilize without relying on visual input. Next, we're going to directly target and strengthen the posterior tibialis with banded ankle inversions. We're going to do this for 3 sets of 10 repetitions. Start by sitting on the floor with both legs extended straight out in front of you. Cross the leg you're working on over the opposite leg. Loop a resistance band around the ball of the working foot just below the toes and anchor the other end around your opposite foot to create tension. From this position, keep your working leg stable and slowly rotate your foot inward as if you're trying to point the sole of your foot away from the opposite leg. Pause briefly at the end of the movement, then return to the starting position in a slow and controlled manner. This exercise targets the posterior tibialis. This is the primary muscle responsible for inverting the foot and supporting the medial arch. Strengthening this muscle helps improve foot stability and restores proper load-bearing mechanics. More importantly, controlled loading through resistance exercises like this promotes tendon remodeling, improving the tendon structure, strength, and ability to tolerate stress. Over time, this can reduce pain, support better alignment during walking, and prevent further injury by making the tendon and surrounding musculature more resilient. The next exercise is the heel raise, which you'll do for 3 sets of 10 repetitions. Start by standing with your feet about hip width apart and near a wall or sturdy surface for balance. Slowly rise up onto the balls of your feet, lifting your heels as high as you can. As you do this, focus on pushing through your big toe. This adds a medial bias, which specifically activates the posterior tibialis muscle more effectively. Pause briefly at the top, then slowly lower your heels back down with control. As you get stronger, there are a few ways to progress this exercise. One option is to perform single leg heel raises, which increases the demand on the posterior tibialis and surrounding stabilizers. Another way to add challenge is by holding a dumbbell or weighted object in one hand while using the other for support. This progressive loading is crucial for tendon remodeling. It stimulates the healing process, restores strength and endurance, and helps the tendon adapt to the demands of walking, running, and other weight-bearing activities without pain. The next exercise is a balance and reach drill, and we'll perform it for 1 minute. Start by standing tall on your affected leg. Once you feel steady, use your opposite leg to reach forward and lightly tap the ground with your toe, then return to the center. Next, reach behind your body and tap out to the right, then return to the center. Finally, reach behind and across your body to the left. This should form an inverted Y pattern. Repeat this sequence slowly and deliberately for the full minute, keeping your movements smooth and controlled. This exercise challenges your dynamic balance, requiring the posterior tibialis and other stabilizing muscles around the ankle and foot to stay active as your center of gravity shifts in different directions. It closely mimics real-life functional demands like walking on uneven ground, stepping off curbs, or adjusting your foot position during daily movement. Training this kind of neuromuscular control is essential for restoring ankle stability, improving tendon resilience, and supporting long-term recovery from posterior tibial tendonitis. The final exercise in this program is the standing calf stretch, which will hold for 30 seconds. To perform it, stand facing a wall with one foot forward and the other foot stepped back. Keep your back leg straight and your heel firmly planted on the ground. Bend your front knee slightly and lean into the wall until you feel a gentle stretch along the calf of your back leg. Make sure your toes are pointing straight ahead and your back foot doesn't rotate outward. This simple and easy program should be done once per day consistently for at least 4 to 6 weeks. That's about how long it typically takes for tendon tissues to heal and adapt to strengthening. Don't expect overnight results, but with consistency, you should notice better pain control, improved ankle stability, and a return to the activities that you enjoy. Now, if your posterior tibial tendonitis started after an ankle sprain, or if your ankle still feels weak or unstable, my next video will show you the best exercises to rehab your ankle after a sprain. The exercises pair perfectly with this program to restore full function. Check it out next, and thanks for watching.